everyone! I am Christine Joy Zulveta and today we will be managing clients using electronic medical records. EMR is a digital collection of information about a person in a computer. It includes patient health history, diagnosis, medications, tests and laboratories, immunizations, and treatment care or treatment plans. It is also called electronic health record. And now, I will be showing you a demonstration of EMR using OpenMRS. I have here a workflow or steps that we will be doing while using EMR in healthcare management. First, we will be logging in onto the website, then register the patient, which includes the demographics of the patient, then start visit, enable for us to admit the patient, and then capture vitals, wherein it includes the BMI and the vital signs of the patient. Then visit note, wherein we will be inputting the primary and secondary diagnosis and our nursing notes. And then we will be inputting all allergies given by the patient. And then after doing everything that we need to do, we can end the visit. Now we will log in onto the website. And then register a patient. Good morning, sir. I'm Christine Joy Zuleta, your student nurse for today. Can you please state your name po?
Carlos Joshua Zulveta Faustino.
Your birth date po?
November 23, 2004.
And yung address nyo po?
First, Dr. Viola Street, Newgan, Malabon City.
Phone number po?
0997-345-1762.
And who's with you po?
My mother,
Ano pong name po?
Normita Zulveta.
Thank you po. Confirm. And then next, we will start visit so that we can admit the patient to inpatient ward. And then we will capture vitals, input height, weight, and the system will calculate the BMI, temperature, pulse, the RR, BP, and the oxygen saturation. Then save the vitals. Next is visit note. In here, we will put pneumonia as our primary diagnosis. Then we will input our nursing notes, which includes assessment, the subjective data, then for the objective data, skin feels hot, WBC 30,000, and the X-ray shows possible bilateral lower lobe pneumonia. And for our nursing diagnosis, ineffective gas exchange related to sick secretions. Surveillance. Shortness of breath and coughing of greenish to brown sputum. for nursing interventions. Encourage mobilization of secretion through ambulation, coughing, and deep breathing. And ensure adequate fluid intake to liquefy secretions and prevent dehydration caused by fever and tachypnea. And encourage rest and good diet. And place patient on 2 liters O2 by nasal cannula per physician's order. Then instruct the patient to use incentive spirometer for effective oxygenation and airway clearance. Next is patient education. Educate the patient about the benefits of the pneumococcal vaccine. Then for our discharge planning, ensure that the patient understands all medications, including route, dosage, action, and adverse effects. Instruct patient to notify their primary healthcare provider of any change in the color or consistency of secretions. See, then we will now add new allergy. Ibuprofen, GI upset, mild. Shellfish, rash and itching. And you can comment intervention or medication that the patient is taking whenever allergy occurs. And save. So these are all the relevant information that we encoded. As you can see here, the vital signs, they are well documented. So, and early detection of preventable outcomes is key to timeline intervention. So it is very relevant. The allergies, the weight graph, and here are the clinical notes that we input earlier. We can edit that whenever change happen. And once done with everything, we can now end the visit. This is how you find a patient and patient information. Click Find Patient Record. Type the first few letters of the patient. The benefits of electronic medical records is that compared to sorting papers in a folder, EMR database can save time when vital information of the patient is needed. Just like what we did earlier, we demonstrated its ability to search information in the patient chart. And also, once an information is updated, anyone with access can see it anywhere you are in the hospital. And it reduces workload. Also, it can reduce unnecessary investigations, and it can prevent medication errors. And of course, it can enhance and improve communications and interactions between primary care providers, the patients, and other providers that is involved in the care. Unfortunately, we don't have EMR here in the Philippines, but we have websites just like OpenMRS that can help us practice or do simulation of recording digitally. And that's all. I hope you learned something. Bye!